Constance Wong again from Excellence in Dentistry. Today I'm going to share some advice on buying the right toothpaste that's right for you, and also talk a bit about the active ingredients in toothpaste. So if you're watching live, hi there, please feel free to interact by leaving any messages or any likes, and also by sharing the video as well. So the main ingredient I look for in toothpaste is fluoride. I've talked about fluoride before, how it helps to protect the teeth from decay, and national guidelines state that a family toothpaste should have fluoride in it that's between 1,350 to 1,500 parts per million. So that's how much fluoride is in the toothpaste. If you look on the back of a toothpaste, in amongst all the ingredients, it should state how much fluoride is in the toothpaste. So pretty much all the main brands, if you go for like Colgate, Sensodyne, McLean's, Oral-B, all of them will have that range of fluoride in it, and it's usually around about 1,450 parts per million. So that's the number you need to look for. I would give you a tip is that all children can technically use adult toothpaste. So the national guidelines state that children under the age of 3 should use toothpaste with fluoride with at least 1,000 parts per million. Any children above 3 should be using family toothpaste. So if the child isn't swallowing or eating the toothpaste, they can actually use toothpaste that has 1,450 parts per million in it. So I think that will probably help you at the supermarket. You don't need to buy an extra tube of toothpaste, and also it'll be easier to get the child off bubblegum toothpaste if they are using the minty toothpaste earlier. So that's just a tip there for you. Some patients and some people are worried that fluoride has adverse effects. So you can get fluoride-free toothpastes, such as this one here is by a company called Splat that doesn't contain any fluoride in it. I personally see more benefits to having fluoride than the risks. So that's why I personally recommend fluoride toothpaste. There are also other ingredients in toothpaste. So things such as triclosan. That is an ingredient that is found in some toothpaste such as Colgate Total. That helps to reduce gum disease. So it's good for patients who have gum disease. Things such as for sensitivity, you can get things such as arginine or stannous fluoride. That's what you find in Pro Relief and Oral-B, and that helps to reduce sensitivity. And you can also get things to help whiten the teeth or lighten them. So you can get toothpaste that have special abrasives in them, or hydrogen peroxide, or actually activated charcoal is another thing that's going around in the media at the moment, such as this toothpaste, which is actually black. You can see it on the inside, it's like black toothpaste. That's apparently supposed to help whiten the teeth as well. So all of these different ingredients can have an additional benefit, but you could have the best toothpaste in the world with everything in it, but if you're not cleaning properly, then you won't have clean teeth. So at the end of the day, I just say as long as you've got a good toothbrushing technique, it doesn't actually matter what toothpaste you use. One more thing that I'll talk about, another ingredient, is something called sodium lauryl sulfate. So this ingredient isn't just found in toothpaste, it's also found in a lot of beauty products like body washes and things like that, or face washes. It's a foaming agent, and it's also a thickener and a surfactant. And some people believe that they can have adverse reactions to this ingredient. So if you want to try and avoid that ingredient, the main brand on the market that doesn't contain sodium lauryl sulfate is Sensodyne. So if you're worried, go for Sensodyne. Or you can go for other brands like this one again, doesn't have sodium lauryl sulfate in it either. So lots of people ask, what toothpaste do I use? Honestly, I use whatever free samples I can get from trade shows and through the post. But at the moment, I am trialing this Curaprox Black is White toothpaste because it has activated charcoal in it, and I want to see whether that has any benefits. So I'll keep you posted on that. Otherwise, if I'm not using that toothpaste, I just generally like Oral-B toothpaste, just because I like the taste. I've found that things like Colgate Total or the Colgate toothpaste are very minty, they're very fresh feel to it. I prefer something sweeter, so that's why I prefer the Oral-B or the Pro Enamel. It's just a little bit less minty. So I think I have covered everything, so thank you for watching. If you enjoyed the video, I'd appreciate any likes or any feedback, so please leave comments in the in the comments box, and don't forget to share the video if you think your friends will like it as well. Next week I'll be talking about mouthwashes to follow on with our supermarket shopping type theme. So if you have any specific questions on mouthwash that you want me to answer, leave a comment and I'll include it in the next video. Otherwise, I hope you all have a lovely day, and I'll see you at the same time next week. Take care. Bye.